I just graduated from high school, so I'll be attending Boston University in the fall. I worked with Dr. Andrew Alexis and Dr. Marian McCall for 2 years ago, and this is my project, skin bleaching practices amongst US patients. I work at Columbia University. So as an introduction, this molecule right here is called hydroquinone. It's made out of 2 H molecules, which is alcohol. And a little bit about the social science area of this. So in the eastern part of the world, like China, India, and Africa, they believe that later skin is more beautiful due to like historical references like transatlantic slave trade and how Britain conquered Africa and in China like earlier. So that's why they believe that lighter skin to be more superior. And so in order to mirror and have the same superiority as these people who conquered them, they use these skin bleaching creams called hydroquinone. And in hydroquinone, there are 3 main active ingredients. Hydroquinone, of course, corticosteroids, and mercury. And we all know that mercury is in those like thermometers, and you you're not supposed to eat them. So hydroquinone can cause neuropathy, which is a brain disorder, exogenous ophrenosis, which is it causes like suppression of it restricts blood pressure, suppression of hypothalamic and pituitary and adrenal glands, which is one of the 3 main glands that makes your body function. And long-term effects are DNA damage and mutations. It has the ability to disrupt protective mechanisms in the body, which can lead to cancer, so basically cell buildup. And it can also cause aplastic anemia and acute myeloid leukemia in the bone marrow, which means that in the bone marrow there are cells that basically help you function. And so what hydroquinone does is that it stops these cells from producing. And mercury can lead to permanent damage in the brain, liver, kidney, and corticosteroids can cause acne, pigmentary disorders such as splotchy spots all over your skin, stretch marks, and cutaneous infections. There are alternatives to hydroquinone, such as if you combine a 20% azelaic acid with 15% glycolic acid, it equals to 4% hydroquinone cream. But at the same time, 4% hydroquinone cream is very, very little, and so it will take a long amount of time for the skin to respond to it. The other 2 alternatives to hydroquinone is soy extract and kojic acid. The thing is that with soy extract and kojic acid, it takes 12 weeks for the skin to respond in order to be lighter, and whereas hydroquinone, it will take around 2 weeks. So a woman would usually wouldn't take the safer way out, which is right here, soy extract, kojic acid, and azelaic cream, and they would prefer using hydroquinone because it's faster. So here are some statistics. So studies show that women who are under 40, unmarried, divorced, use skin bleaching agents. And so this is basically to attract mates. So studies also show that men prefer lighter skinned women over there in the Eastern Hemisphere. And in Nigeria, 27 to 60% of the population lighten their skin. It's men and women. And like I said before, the reason is to lighten complexion, improve appearance, and to even out their skin tone, and most of all to attract a mate. And also, furthermore, in Dakar, Senegal, 99% of women use skin bleaching cream agents, which is very, very crucial. And 68 of these 99 women use skin bleaching agents during their pregnancy, and 64 just use hydroquinone, and because there are other skin bleaching agents out there that are also worse than hydroquinone, 28 of them use highly concentrated topical steroids, which basically can kill them faster. And women who use these skin bleaching agents during their pregnancy, their baby, so like when a woman was pregnant, there's something called the placenta, which is like a little tube connecting to the fetus, and it transfers nutrients to the baby, and if they use these type of creams, it can cause physical damage to the infant, and it also increases the chance of having a lower birth rate with the baby as well. So while I was in the hospital at Columbia, there's this 45-year-old Senegalese woman who came in, and she's an immigrant as well. So she claimed that her body was itching, and there were like skin discolorations, and her sister and brother has the same problems. When we tested her for medication allergies, she didn't have any allergies as well. So this is her, and I don't like the light is really bad at the moment, but if you see, like right over here, that is not a light. That is basically one of the splotchy spots, and over here too, and on her eyes, they're all like it's all like whitish, and then her whole skin was discolored. Guys, there's more pictures out there. So that's her back. Over here is white, and then over here is white, and then over here, like the edges are all brown. So basically, her skin is discolored as well. So later on, the patient returned to the clinic, and because we asked her if she bleached her skin, because that's the only conclusion we can come up with. And she says that she has been bleaching her skin for over 30 years, and so has her brothers and sisters. And she even recommended her daughter to use it as well. And when we asked her to bring back her products, she claimed that, and many of the products, which is like a whole big bin of products, contain hydroquinone. And these are the products she used. This is like about 1/3 of the products she used. That's the woman before, and this is after she used the creams. Yep, so that's before. That's after she used the creams, and this is after she stopped using the creams. So it has a really, really large effect on it. Oh, I'm sorry. So our goal is to find out how common skin bleaching is in the US, because since we're researching in New York City, it's like the melting pot of immigration of people, and there's a lot of immigration coming in. So our goal is to survey about 1,000 New York City patients from the dermatology clinic. Most of them will be from different ethnic backgrounds, and we want to see people's perspective of skin color and how satisfied their skin color is. So what we did so far is we distributed surveys to 3 hospitals in English and Spanish, St. Luke's, Roosevelt, and Beth Israel. And we collected surveys, I collected surveys from the 3 hospitals every 1 to 2 weeks, and I would record it in Microsoft Excel. And sometimes I would have conversations with patients if they do go into, if they do use skin bleaching agents. And at the moment, because I was there about 2 years ago, I just helped initiate the project, which is and so we only collected about 100 surveys so far within the 1 summer, so progress is pretty good. And since this project is ongoing, we will still be collecting surveys from 3 hospitals. This is just a sample of the survey. We just asked how old are you, where are you from, where are you born, if you were born outside of the US. And one thing that that was very, very crucial was their education level, because results so far states that people who graduated from middle school to elementary school, they're the ones that actually do use skin bleaching creams more than people who have a college degree, which is, so results are basically very expected in a way. Here is my references and acknowledgement. And I want to thank Dr. Sack, Dr. Andrew, Alexis, Marianne McCall, my co-mentor, Marcy Coley, HCS, and my teacher, Ms. Ellen Mallory. And that's it.
How does the cream actually travel to the skin?
Oh, okay, so in your skin, there's a lot of pores, right? So these creams are usually applied topically, which means that it's usually applied off the skin. And so these creams will seep into your pores, and then it will, and your body and your glands will usually tell the pigments in your skin to produce melanin to give your skin color. This cream will kill all the melanin cells. So without the melanin cells, you can't produce color. You can't produce color in your life. Any other questions? Yeah.
Do you know what the example?
Yeah, sure. Yeah.
What effects does this
Excuse me,
have?
students, this is a reminder once again. If you need to speak, you raise your hand, you are asked to stand up. The rule hasn't changed from week to week. Can you remember that? Got it? Okay. So let's go forward.
Can you stand up?